Hi everyone, in this video I'm going to talk about 4 management strategies to help with Osgood-Schlatter. The first one is, similar to Seaver's disease, is that you want pain to be your guide. So if pain is causing you to limp or move differently, you want to limit those activities that are going to be the most aggravating, such as running and jumping. The second thing is stretching. Stretching of the quadricep muscle is going to be beneficial because it's going to decrease the tension and pull of that muscle on the patellar tendon and growth plate at the tibial tuberosity. You can start this stretch laying on your stomach. You can use a stretching strap, a belt, a dog leash, or a towel. One thing to know with this stretch is that you don't want to be propped up onto your elbows because that's going to increase the tension in your low back. So you want to make sure that you're laying nice and flat. You want to hook the strap over the top of your foot, and then you want to pull your heel towards your bottom until you feel the mild discomfort of a stretch. You can also do this stretch in standing, as a standing quad stretch. With this one, standing on one leg, you're going to take a hold of your other leg above your ankle joint to protect it. Again, you want to note is that you don't want to have that arch in your low back. So you want to make sure your core is engaged to keep your spine nice and neutral. You want to pull your heel towards your bottom until you feel the mild discomfort of a stretch. You want to hold these stretches for 30 seconds. You want to do 3 rounds of them 3 times a day. The third tip I have for you is strengthening. Strengthening is going to be beneficial because it's going to decrease the stress on the knee joint and help to protect it. The first strengthening exercise I'm going to show you is going to be a straight leg raise, which is going to activate and strengthen your quads. So sitting down on a firm surface, the leg that you're not using first, you're going to bend it up with your feet flat on the floor. The one that is going to be working is going to be straight out in front of you. You're going to want to engage your quads by bringing the back of your knee down towards the mat and your ankle toward you. Keeping your knee straight, you want to raise your leg off the floor, about 2 feet off the floor. You want to hold this position for 5 seconds and then slowly lower your leg back down. You're going to want to do this 12 times and you want to do 3 rounds of those. The next strengthening exercise I'm going to show you is going to be a bridge, which is going to activate and strengthen your glutes. Laying on a flat surface with your legs propped up, shoulder width apart, and your feet flat on the floor, you're going to engage your glutes and then lift your hips off of the ground. One thing to note here is that you don't want to get this big arch in your low back. So you want to make sure that your spine is staying nice and neutral so only your glutes are working. You want to hold at the top for 5 seconds and then slowly lower it back down. And you want to do that 15 times. You want to do 3 sets of those, and then in total, with both of the strengthening exercises, you're going to want to do it 1 time a day. The last recommendation I have for you is the use of a knee strap called a Chopat Strap. The strap is going to be beneficial because it's going to help to distribute the forces more evenly along the patellar tendon, which is going to decrease the pressure and pulling at that tibial tuberosity. You can see the link below to the straps that we commonly recommend to our patients. If you guys have any questions about the recommendations that I gave today, you could reach out to me via email.